Good morning, everyone. Welcome to our annual benefits presentation. We're pleased to have all of you with us this morning live and want to invite you to type in your questions as we go. We have staff here to help you get the answers that you need right away. In the event that we don't get to all of them during the presentation, we will absolutely make sure that they are answered afterwards. So good morning. My name is Mary Lockenbrook. I am the Executive Director of Benefits for the Montana University System. And on behalf of Commissioner Christian and our entire benefits team here in the Commissioner's office, welcome to annual enrollment for fiscal year 25. As you know, our fiscal year 25 benefits will run from July 1 of 2024 through June 30 of 2025. Today, we'll walk through what you can expect when you enroll for your benefits for the upcoming fiscal year. First of all, we'll provide the annual enrollment dates, some information on dependent eligibility. We'll walk through medical plan benefits and prescription drug benefits. We'll talk a bit about the dental plan benefits and our Montana University System fee schedule, vision hardware benefits, a few provider network reminders. We will address the dependent premium hardship waiver. We'll talk in depth about flexible spending accounts. We'll discuss our wellness programs, and then we have a few annual enrollment reminders for you. So to start off, enrollment this year will happen from April 24th through May 15th. So enrollment will open on Wednesday and will run through May 15, 2024. As we'll talk about later, many of you are going to want to get on and complete your enrollment for a variety of reasons, but particularly if you're interested in a flexible spending account, you will want to get on and make sure that you actively enroll. If you do not get onto the Benefit Solver platform and enroll for fiscal year 25, all of your current benefits will roll over for fiscal year 25, with the exception of flexible spending accounts. So we wanted to talk just a little bit about the history because we think that this is pretty unique to our plan. And we're also really proud of where we're at in terms of the value of benefits that we are able to provide at a very affordable cost. So the employer contribution that you receive for each employee has not changed since fiscal year 17. In addition, we have not made any changes to our medical plan premiums since fiscal year 17. Dental plans have had no premium change since fiscal year 18. Vision hardware has had no premium changes since fiscal year 20. And we have made no adverse changes since fiscal year 2016. We have only enhanced benefits. So what that means is you have not seen changes to increase your deductibles or your copays or your out-of-pocket maximums, no decreases to the benefits that we're offering. We have only added a few enhancements since that time. So when you talk about the fact that we have not had changes in this time frame, and that I'm really thrilled to tell you there are no benefit changes or premium rate changes for anyone for fiscal year 25. That is a pretty astonishing feat, and we're really proud to be able to offer this to you because we know that it's important to all of you, our employees and your families around the state. We are already hard at work on fiscal year 26, and we do anticipate that there will be changes next year. But for now, we want to focus on the fact that while other health plans have averaged premium increases of anywhere from 6% to 30% every year, over those past 7 years, we're thrilled to offer you another year with no benefit changes and no premium increases. So first, let's talk a little bit about dependent eligibility information. For those of you who do not have your dependent children up to age 26 enrolled in your medical, dental, or vision hardware, annual enrollment is that opportunity for you to add your children to your plan. Keep in mind that the university system has closed enrollment for medical and dental coverage for a spouse. So if you did not add your spouse during the new hire period or when you had a qualifying event during mid-year, then you will not be able to add a spouse to medical or dental during annual enrollment. Please keep in mind that documentation or proof of eligibility is required for your new dependents if you add them during annual enrollment. Please upload that information as quickly as possible, as it does help expedite the processing of the addition of your children. So mid-year enrollment or disenrollment may only occur with a qualifying event. Our plan does use the federal qualifying events. They include things such as marriage, birth, death, divorce, or loss or gain of eligibility for other health insurance coverage. Keep in mind that mid-year qualifying events and what you are able to change during those timeframes does depend on what is considered to be appropriate for the type of event you have. So for instance, the birth of a dependent would allow you to add the dependent, not drop dependents from your plan. Let's talk first about our medical plan benefits. There are no changes. So for in-network benefits, your office visits will remain at $25 for a primary care visit, $40 for a specialist. And then for those things that apply to deductible and coinsurance, the deductible remains at $750 per individual or $1,500 per family. And once that deductible is met, the plan reimburses at 75% of the allowable amount, leaving the patient with a 25% coinsurance. The out-of-pocket maximum remains at $4,000 per individual or $8,000 per family. Once that out-of-pocket maximum has been reached, then the individual or the family, depending on who has satisfied it, will be reimbursed for in-network benefits at 100% of the allowed amount for the remainder of the plan year. We will continue having the first eye exam of the year at a $0 copay with an in-network provider. And just one thing with regard to networks, in the past, we have allowed your hearing exams with an audiologist to be processed on in-network regardless of the network status of the provider. However, Blue Cross Blue Shield of Montana has worked diligently over the past year to get an adequate network of audiologists around the state. So beginning July 1 of 2024, audiologist exams will be processed based on the network status of the provider. So you will want to look for an in-network audiologist. Okay, and then one medical preventive hearing exam is allowed in-network for a $0 copay. Any additional hearing exams would be subject to the office visit copay. And of course, beginning July 1, hearing exams billed by an out-of-network provider will be subject to the out-of-network benefits, which include deductible and coinsurance, and they are separate from the deductible and coinsurance on the in-network benefit. A reminder for everyone, Blue Cross Blue Shield of Montana has changed their mailing address for claims processing. The new address is in Texas. It is addressed to Blue Cross Blue Shield of Montana. And so Blue Cross will be sending all of us new identification cards for both medical and vision hardware, if you have vision hardware, with the new address for our Montana University System plan members. There will be a transition period of 1 year. After that, the Montana post office boxes will be closed. So probably it's best to begin using the new address as soon as possible. Let's talk a bit about prescription drug plan benefits. We will continue to have Navitus as our pharmacy benefit manager, and our copays have not changed. So for tier $0, and there are a few preventive drugs on this tier, it is a $0 copay. Tier 1 for a 1 month is $15, or for a 90-day supply is $30. Tier 2 for a 1 month supply is $50, or a 3 month supply is $100. Tier 3 has a $50 coinsurance, and that coinsurance does not apply to the out-of-pocket maximum. And tier 4 is our specialty medications, and they have a $200 copay if they are purchased at Lumicera Specialty Pharmacy, or a 50% coinsurance if they're purchased at a retail pharmacy. That 50% coinsurance will not apply to the out-of-pocket maximum. The out-of-pocket maximum will remain at $2,150 per individual or $4,300 per family. Lumicera will continue to administer our specialty drugs. Western Drug in Bozeman, CVS, and Target pharmacies continue to be out of network. They are not participating in the University System Plans network. So if you do choose to use one of those pharmacies, you will be responsible for the full charges. You may continue to fill your prescriptions at a retail pharmacy that is in network for either a 34-day or a 90-day supply. Or you may use a mail order pharmacy for your 90-day supplies, and those will be Ridgeway or Costco for the upcoming fiscal year. Let's talk a little bit about dental plan benefits. Delta Dental will continue to administer our basic and select dental plans. Our basic plan is for diagnostic and preventive services only, and it does have a $750 annual maximum per plan member. The select plan covers diagnostic and preventive, basic and major restorative, and it also has a separate benefit for orthodontia services. Orthodontia has a lifetime maximum of $1,500 per plan member, and the other services on the select dental plan have a $2,000 annual benefit maximum per covered plan member. However, the annual plan maximum does not apply to your diagnostic or preventive services. So what that means for you as a patient is that you can have your cleanings and your exams twice a year, and they will not apply to that $2,000 annual benefit maximum. And that's done with pure intent to ensure that people who might have something major happen during the plan year, and maybe they need a couple of implants or they need a couple of crowns and they're going to exhaust that $2,000 annual benefit max, we don't want to discourage people from continuing to have the diagnostic and preventive services. So we want you to continue to have your cleanings even if you have already utilized the $2,000 annual benefit maximum. I know that there's one thing that is on the minds of many of our plan members around the state, as we have seen an exodus of providers from the Delta Dental network. So there's a couple of things that we want to remind you of. The first is that the university system utilizes a fee schedule. We do not utilize a network model. And what's important about that to you is that you do not need to have an in-network Delta Dental provider. You will still get the fixed dental fee schedule reimbursement for your dental services, regardless of the network status of the provider. You can find this in the Choices workbook, and that is a shortened version. The full version of covered services and the maximum reimbursements is located in the summary plan description. If you have services, any difference between the billed charge and the fee schedule fixed reimbursement amount is the responsibility of the patient, and that has not changed. So you do have freedom of choice to visit any licensed dentist, but there are times when the out-of-pocket cost may be reduced if you do utilize an in-network provider with Delta Dental. So to that note, I want to let you know that Delta Dental, our account team at Delta Dental has advised that they are committed to doing what they can do to get some of the providers who have left their network back in. But it's important to understand that there are many complexities involved when you're dealing with provider networks. Some of those have to do with reimbursement amounts. Some of those have to do with what individual dentists or dentists that have banded together want to do with their own practices. So some of you may have received letters from dental offices telling you that they are not participating with any networks. So some of you have reached out and said, well, why don't you leave Delta Dental and get another third-party administrator? And it's not as easy as that for a couple of different reasons. One is we do have a contract in place, and another is that many of these dentists that have left the Delta Dental Network have also left Cigna, Aetna, Blue Cross Blue Shield. Many have indicated that they're going insurance independent, because what that does for them is twofold. It allows them to bill patients upfront for the full cost of services, so they're never chasing reimbursement from patients. And it also allows them to really set the fee that they want to charge for any of their services. This is not the first time that we have seen something like this happen. However, it is disturbing to us because we would like to see a number of in-network options for all of you around the state. The places where we have seen the most activity in terms of dental providers leaving the network has been in the Gallatin Valley, so the Bozeman area, Missoula, Helena, and now we're seeing some in Butte. So I just want you to know that we are aware of it, that we are staying close with our Delta Dental account team. But in terms of our benefits, we do not have a network model. And that's important to you because in a network model, benefits would be reduced if you utilized an out-of-network dentist. And that will not happen for you. You will be allowed the maximum reimbursement based on our fee schedule reimbursement. So let's talk briefly about vision hardware. Again, no changes to benefits and no changes to premiums. So you will continue to have a benefit up to a $300 annual allowance for eyeglass frames and prescription lenses in lieu of contacts, one pair, one purchase per covered plan member per year. Prescription contacts may be purchased in lieu of frames and lenses. Again, it is one purchase up to $200 annual allowance per covered plan member. I know many have provided feedback that they like to buy 6 months at a time and that doesn't use their full $200 allowance. If that is you, you might want to consider buying 9 months or 1 year supply to get your full $200 annual allowance. And then again, just reiterate that the eye exam, whether routine or medical, is provided as part of the medical plan. You get one per year at a $0 copay when using an in-network provider. And then just remember, this is hardware only. Again, your eye exam processes on medical. So this is for frames and lenses or contacts. A reminder on provider networks. It's really important, anything that you can plan, please make sure you're using in-network providers. On the medical plan, this is important to you because if you utilize in-network providers, you will not be balanced billed any difference between the allowance and the charge. If you use out-of-network providers, you can and likely will be balanced billed the difference between the provider's charge and whatever the allowance is for that service. And I emphasize this every year, but I don't think it can be emphasized enough that we have every year at least one individual who tells us they want to use this out-of-network provider for whatever reasons they have. They know they'll be balanced billed, and that's okay. And then they receive the services and they find out that the amount that they're being balance billed is $15,000, and suddenly they're not okay with that. And I am not making light of this situation. I understand how difficult it is for people to navigate the healthcare system and to do it at a time when you're dealing with either your own illness or a family member's illness. And you're really, there's a lot of things that we tend to move to the back of our mind or reduce them on our priority lists until we get the bill. And then the bill comes and that becomes kind of the number one issue that we're looking at on our priority list. And we cannot protect you from balance billing after the fact. So please pay attention prior to receiving services. Always check, do not assume participation. The last 6 months have been wonky in regard to provider networks and changes in those networks. And you can no longer just assume that my provider has always been in network. We've had situations where a provider left the network and didn't even tell the patients. So it's really important that you always double check that. You can also contact your claims administrator, which is Blue Cross Blue Shield, or call our office if you need assistance finding in-network providers. We understand that that navigation process can be tricky, and we are happy to help you through it. You can also utilize the Blue Cross Blue Shield of Montana online provider finder. And those websites have been provided for you for both Blue Cross Blue Shield and Delta Dental. But remember, your benefits do not change on the dental side, only on the medical side, where we have a different benefit for out-of-network providers. We, over the last few years, have really seen a reduction in the number of employees who are utilizing the dependent premium hardship waiver. So we just wanted to provide a reminder to you that the Montana University system does offer a dependent premium hardship waiver, and it's designed to assist employee families who have a financial hardship with the cost of medical coverage for dependent children between the ages of 0 and 26 who are covered on our Choices medical plan. This is a really unique benefit. I'm not aware of any other plans that provide a benefit like this one, but it really speaks to the commitment that our benefits team, our Commissioner of Higher Education, and our Inter-Unit Benefits Committee, which is representatives from union and management across the state, that really value the opportunity to ensure that children have medical coverage. So in order to apply for the premium hardship waiver, you must first apply for Healthy Montana Kids for all children under the age of 19. If Healthy Montana Kids denies coverage due to not meeting the income guidelines, then you may complete a hardship waiver application and submit it to our office here at the Commissioner's office, requesting consideration for the premium waiver. If the total household income is not more than 125% of the Healthy Montana Kids income guidelines, covered dependent children will be eligible for the premium waiver for the fiscal year of 2025. So you would receive it for the entire plan year. The family must reapply for Healthy Montana Kids and submit a waiver application each plan year prior to annual enrollment. Actually, that can be provided throughout the annual enrollment period to be eligible for the premium waiver. So we want those to come in during April and May so they can be set up for July 1. You can visit our Choices website. It's listed here on the slides to apply, or you can call our main benefits number to talk to one of our staff members regarding the dependent hardship waiver. Flexible spending accounts. This is really important. This is, if you're only listening to one thing today, it's probably a toss-up between our dental benefits and our flexible spending accounts, but I'm going to direct you now to the flexible spending accounts. Much of this is the same, but there is a change. So I'm going to walk through this and really emphasize the change. So first of all, again, we are pleased to let you know that benefits will pay the administrative fees. So employees who utilize flexible spending accounts will not be charged the administrative fees that are levied on those accounts. Those will be paid by the benefits plan. We do offer 3 flexible spending account options. They are all administered by Health Equity WageWorks. Those include a healthcare flexible spending account, which you can utilize to submit your out-of-pocket expenses for medical, prescription, dental, vision expenses, over-the-counter pharmacy expenses, and there are some other items that can be purchased with your medical healthcare flexible spending account. We'll talk about that a little bit later. There's also a limited purpose flexible spending account. And with this account, you can submit out-of-pocket expenses for dental and vision only. And then we have the dependent care flexible spending account, which is for daycare or some limited elder care expenses only. Please do not confuse a dependent care account with a medical account for dependents. Your healthcare flexible spending account is for all of your family members, for all of your medical, prescription, dental, and vision. Dependent care is a daycare account. That would be for children under the age of 14, so 13 and under. These flexible spending accounts are optional reimbursement accounts, and they allow you to set aside a portion of your wages pre-tax in equal installments throughout the plan year, so July 1 through June 30th. They allow you to pay for qualified out-of-pocket expenses for healthcare and dependent care services. They may only be used for expenses incurred on or after the flexible spending account effective date. This includes debit card transactions. Please do not use your debit cards in July to pay for services that you received in June. Those are not eligible expenses to apply to your debit card for the new fiscal year. And you may find yourself being asked down the road to pay back to the flexible spending account because they were not eligible when you made that purchase. Now, here is the change. If you didn't hear anything I said above, please listen closely. There is no automatic enrollment in flexible spending accounts. You must re-enroll each annual enrollment to participate in a flexible spending account and to contribute contributions. No exceptions can be made on late enrollment. So do not contact us in June and say, oh my gosh, I know now I need a flexible spending account and I want to set one up. If you did not set it up between April 24th and May 15th, you will not have a flexible spending account for fiscal year 25. These elections are irrevocable, so please check the first paycheck. Even better, check your benefits summary after you complete enrollment prior to July 1 to identify any issues there may be with any of your benefits. But because flexible spending accounts are IRS tax vehicles, they are subject to all Internal Revenue Service rules. We cannot make retroactive changes after that first paycheck in July. So you need to identify if you find a mistake, and they do happen. Sometimes it might be a typo when it's entered into the payroll system. So for example, you may have elected $200 per paycheck and it gets typoed into the payroll system as $20. Or maybe you elected $20 and it gets entered in as $200. Those are the kinds of things we need you to catch right away so that they can be corrected so that you actually get what you elected during the annual enrollment period. No changes to elections will be allowed after a new employee's first paycheck or a continuing employee's first paycheck of the new plan year or at the first paycheck following a qualifying event. So it's really important. I know many people tell us they don't watch their paychecks. It's really important that you do after annual enrollment. Now, your healthcare spending accounts. Again, your healthcare flexible spending account is for medical, dental, prescription, and vision. You can check the healthequity.com website to see a list of expenses that may require medical necessity or prescriptions from your doctor. If you and or your legal spouse are enrolled in a high deductible health plan with a health savings account through another insurance plan, you are not eligible to elect the Montana University System General Purpose Healthcare Flexible Spending Account. We tell you this just for purposes of education because the university system does not have high deductible health plans, nor do we have health savings accounts. However, in an effort to assist you to not have issues with the IRS, we're letting you know that high deductible health plans with health savings accounts or standalone health savings accounts do not play with flexible spending accounts. So if you or your spouse have one, even if it hasn't been utilized in years, but it's got $12.54 in it, you are not eligible for a flexible spending account. We do offer, though, a health savings account compatible limited purpose flexible spending account that you could elect if you or your legal spouse have a health savings account. You could use this limited purpose flexible spending account for dental and vision expenses. This could include dental exams, dentures, contacts, eyeglass frames, prescription lenses, any expenses for you and your dependents for vision or dental services. And the guidelines are the same as they are with the exception of what is eligible. And again, at healthequity.com, you can see what expenses you might be able to submit to that account. The minimum amount you can contribute to a healthcare flexible spending account remains at $120 for fiscal year 25. And the maximum, the IRS did increase that to $3,200 this year. So a maximum of $3,200. If you do not enroll in a flexible spending account for fiscal year 2025, and you have unused flexible spending accounts in the amount of $50 or less that are not expended by June 30th of 2024, the flexible spending account will be closed and the unused funds will be forfeited. New healthcare flexible spending account participants will automatically receive a Visa healthcare debit card at no additional cost. So that will be sent to you once you sign up. Your reimbursement options for your health flexible spending accounts include direct deposit, debit card, or pay me back or pay my provider. You can do those online or in the app. The flexible spending account store, which is just fsastore.com/exclamation. This is where you can go to see what kinds of things that you could purchase through the WageWorks FSA store. If you would like to conveniently order and pay for items online that are eligible for reimbursement under your flexible spending account. Now, we already talked about these plans, these flexible spending account plans being IRS tax vehicles. So the IRS permits healthcare flexible spending accounts to roll over a limited amount of unused flexible spending account contributions from one plan year to the next. This means that for the healthcare flexible spending accounts or the limited purpose flexible spending accounts, balances from the current year, which will end in June of 2024, can be rolled over to the next plan year that begins July 1 and ends in June of 25. But we encourage you to not elect more than you will need to cover expenses incurred by you or your eligible dependents during the plan year, because the IRS calls these plans use it or lose it plans. This is big for you because this is new. Beginning July 1 of 2024, we will no longer allow unused flexible spending account contributions to roll over if you do not re-enroll in a health plan flexible spending account for fiscal year 25. Under the use it or lose it rule, any flexible spending account contributions not used by the end of the plan year will be forfeited. So if you have money in your fiscal year 24 account that you want to roll over to fiscal year 25, get online and enroll in a flexible spending account for either a health plan or a limited purpose for fiscal year 25. Otherwise, your excess funds will not be rolled over, they will be forfeited. The IRS allows $610 of unused flexible spending account contributions from fiscal year 24 to roll over into fiscal year 25 if you elect a flexible spending account for fiscal year 25. So that means if you get to June 30th and you've submitted claims for all of your expenses through June 30th and you still have $524 in your flexible spending account, and you want it to roll over to fiscal year 25, you want to get online during annual enrollment and elect a flexible spending account. Because if you don't, that $524 you had will be forfeited. You can get on and just do the minimum amount. You don't have to elect a large dollar amount. And most of us can use up that minimum election on pharmacy copays or primary care copays. That's not a large amount of money. So if you want your money to roll over, please make sure you get on during annual enrollment and elect a flexible spending account. The IRS has increased that amount for fiscal year 25. They will allow $640 from fiscal year 25 to roll over into fiscal year 26. Again, if you actively elect a flexible spending account for fiscal year 26. Cannot stress this enough. If you want rollover funds for your medical flexible spending accounts, get online during annual enrollment and elect a new flexible spending account. Dependent care accounts, these flexible spending accounts, remember, are used for daycare expenses or some limited elder care expenses. This is not, I repeat, not used for reimbursement of healthcare expenses. Every year, we have somebody say they thought this account was to pay for their children's medical expenses. It is not. It is to pay for daycare expenses. So you may elect amounts to be withheld from your earnings to assist you for paying for your out-of-pocket dependent care, daycare, or elder care expenses. The minimum amount that you can contribute for fiscal year 25 is $120, and the maximum is $5,000. Eligible expenses include live-in care, babysitters, licensed daycare or preschool centers, after-school care for children under age 14, or for individuals unable to care for themselves. This does mean medically qualified handicaps. School expenses at the kindergarten level and above, overnight camps, and nursing home care are not reimbursable. That's one we get a lot, especially in the summertime with overnight camps. Day camps are eligible. So if you send your child to a science camp that goes from 9 to 3, that is eligible for the daycare expense, but an overnight camp is not. And again, you can find eligible daycare expenses at healthequity.com. Reimbursement options for daycare expenses are direct deposit, pay me back, or pay my provider. You do not receive a debit card for daycare expenses. Daycare expenses are different than medical expenses in a number of ways, but one of those is you must have paid for the services before you can be reimbursed for them. So, and the time period has to have passed. So you need to make sure that you're submitting the claims when you have actually paid the funds. On the medical side, it is different. You can submit the claims, receive the reimbursement, and then pay for them. So your flexible spending account funds may only be used for expenses incurred on or after the flexible spending account AE enrollment effective date. So for this fiscal year, it would be 7/1 of 24, the upcoming fiscal year, and can be used at any time during the benefit plan year, and that includes your debit card transactions. So they have to be services that you've received and been billed for between 7/1/24 and 6/30 of 25. And I should probably qualify that. You receive the services. So if you receive your services in June of 25 and you don't receive the bill until July of 25, because the services were received in June of 25, you could still submit for reimbursement, but all flexible spending account claims must be received by Health Equity WageWorks by September 30th. So for fiscal year 24, that will end on June 30th of 24, you must submit those claims they have to be received by September 30th. So it's not just a submission. Don't put them in the mail on September 30th because I guarantee they will not be received by WageWorks. The best option really is to go online or on the app to submit your claims. All flexible spending account claims incurred during fiscal year 25, which will begin July 1 of 24 and end June 30 of 25, must be received by Health Equity WageWorks by September 30 of 2025. The IRS is very strict about the dates that we provide. We're already allowing a 3-month extension from the end of the plan year, so no exceptions can be made on late claims submissions. So let's move on now and talk a little bit about our Montana University System Wellness Program. And we are just highlighting these, but we're really thrilled to offer a quite extensive, comprehensive number of programs to assist our employees in their prevention, their wellness, their lifestyle management. So to start off, let's talk about our Employee Assistance Program. That is offered through Deer Oaks, and they offer really a comprehensive listing of programs that employees can utilize, that the employer, so each campus can utilize, and they really can be a benefit to our plan members. We offer 2 university system sponsored well checks each plan year, and we do allow our employees or retirees to attend twice per plan year. You must be on the medical plan in order to attend our well checks. And if you are, you receive some basic lab work at no charge to you, and the opportunity to add lab work at an expense to you, but it is less costly than if you had it at your doctor's office. We also offer a wellness incentive program, and that's offered via the Vulcan Pulse platform. Hopefully all of you who are continuing employees are familiar with our incentive program, but if you're not, I would encourage you to go and check it out. We also have live fitness and nutrition workshops and webinars. If you're interested in these, please reach out to Neil Andrews or Kelsey Hartzheim, because they would be happy to set you up to have Neil attend live on your campus and put on some workshops. New is our MUS Wellness Lab. I think you'll find it has a plethora of great information, online fitness, nutrition, and healthy habits via video learning tools. We will continue to offer our Well Baby program in fiscal year 25. This does offer some unique benefits for our soon-to-be moms. So we encourage you to get enrolled in the first trimester of a pregnancy to get the full suite of benefits. But that does prove to offer some nice benefits for our expecting moms. We will also continue to provide the opportunity to utilize the Take Control Lifestyle Management Program. They do really excellent work in helping our members with diabetes, with weight management issues, with hypertension, with high cholesterol. If you should have some lab checks with some things out of range in your lab work, you may get a notice that might indicate that maybe you want to take a look at the Take Control Lifestyle Management Program. We also will continue to offer the opportunity to enroll in Wonder Health, and that is a metabolic disease management program, health for musculoskeletal conditions, Well on Target, which you can access through the Blue Access for employees or Blue Access for members. It's actually BAM, B-A-M, Blue Access for members on the Blue Cross Blue Shield of Montana website. And then Blue Cross Blue Shield of Montana also offers the Blue 365 discount programs. In addition, Delta Dental offers a discount program, Amplifon and Qualsight, for hearing and vision surgery services. So just a few highlights of our employee assistance and work-life program that's offered through Deer Oaks. There are some distinct differences between this and most of the benefits that we offer. And the first is eligibility. This program is available for employees, dependents, household members, and coverage extends for 6 months post-employment. So the two differences are, this includes household members and coverage extends for 6 months post-employment. This can be really important for people who maybe they terminate employment. I'll just give an example. Maybe one of our employees has an aging parent in another state with dementia and really needs somebody to be nearby. So they terminate their employment, but they've been in the midst of having some counseling through the EAP program, and they want to be able to continue that. They don't want the disruption. We don't want that disrupted for them either. So that would continue for 6 months. Household members is important because they don't have to be covered on our health plan. This might serve you in a variety of ways. We have had people call in saying they're having issues with a roommate. You might have maybe an overage dependent, a dependent who is not eligible to be on your health plan. So maybe you have a 32-year-old child living with you. And with the state of our economy today, believe it or not, we are seeing more and more of this where adult children are moving back home. And there can be a number of issues associated with that. Or maybe that adult child has issues that they need to have addressed. They can utilize our employee assistance program. So please encourage that. If you have household members who are not on our health plan, they may still utilize the employee assistance program. There is 24-hour program access. There is a helpline. There is an app called I Connect You that would allow you to text message or call to schedule an appointment with a counselor, or if you have some kind of an emergency, it allows instant messaging. The short-term counseling benefit through the Employee Assistance Program offers 7 sessions with a counselor per person, per issue, per year. So that is a pretty valuable, you'll recall in the past, we've had either 4 or 6 visits. So this is 7 visits per issue, per person each plan year. So a new issue might be maybe somebody has had issues getting along with a coworker. And so they went to the EAP and they had some counseling, and then their husband lost a job and they had some really severe financial issues, and this happens 3 months later. That would be a new issue that would allow for up to 7 new sessions for that individual. There is a telephonic intake and assessment, and then a referral is provided to a local clinician for short-term counseling within 3 days. You can call the referral provider to schedule an appointment at your convenience. They offer counseling both face-to-face and via telephonic appointments. Then there are some alternate modes of support, and some of these, depending on the individual and kind of where they're at, what their needs are. There's the Aware Mindfulness-Based Stress Reduction Program. This is 6 sessions and offers support for participants who are experiencing life stress, pain, and challenges with focus and concentration. And they want to really increase their awareness of and commitment to intentional living. This 6-session program does not apply to the 7 counseling visits. This is completely separate. It's a 6-week program that will help individuals just increase their ability to really intentionally live their lives. There's also a telephonic life coaching. This also is not the 7 visits for counseling sessions. This is 6 telephonic coaching sessions, usually lasts 3 to 4 months. They're 45-minute sessions, and you work with a life coach in that initial 45-minute session, And then you'll set some goals, create a plan, and then the subsequent sessions will be 20-minute follow-up coaching sessions. And then the In My Hands computerized behavioral therapy. So this is CBT. It is actual therapy that can complement the traditional telephone and face-to-face counseling services. This is a self-paced online program, and it allows 7 CBT sessions delivered over the course of 7 weeks with scheduled email or telephone support from qualified counselors and additional support as needed. There are several modules available, including self-esteem, thinking styles, low mood and depression, stress and anxiety, and coping and resilience. Our Employee Assistance Program also offers legal and financial services. You can get a 30-minute telephonic or in-person consultation with an attorney. They also offer a myriad of legal forms online. They have some work-life resource locators, and they can help with a number of things. So some of the work-life resource locators, let's say you have a child who's moving away for college and is looking for off-campus housing, they might be able to help you with that area, or just a number of things, from housing to finding a daycare center to any number of services that they may be able to assist with. And they like to say, let Deer Oaks handle your to-do list. So these are some of the convenience services. They'll help you find pet sitters or obedience training or daycares or assisted living facilities or fitness centers or handyman to help you at your house. Just a myriad of services. And we find this to be a little bit unique in the industry. So we just want to make sure that we're providing an awareness of some of the things that are offered. And then Help Where You Are is the work-life website. You can call day or night for confidential assistance. We've provided the email address and the phone number. The username or password for our university system EAP is MUS. If you are providing it to household members, if you're encouraging them to utilize services, they will need that username or password. And then the iConnectU app code, that code is 250330. And then the Wellness Incentive Program. Again, this runs on a calendar year, so we will finish out the 2024 calendar year of the incentive program in December this year. So again, we're using Virgin Pulse for the platform for our incentive program. It's open to employees and their legal spouses who are enrolled in the Choices Medical Plan. So it is nice that we're able to offer this opportunity for a spouse. We'd love to see a little bit more participation from a spouse. So maybe if you have one at home, encourage them to get online and participate in this program. You earn Pulse Cash by collecting points by participating in wellness challenges, and you can redeem those for items in the Virgin Pulse store. You can also earn additional Pulse Cash by attending a university system well check one time per plan year. Virgin Pulse did merge with a company called HealthComp in November of 2023, and they are collectively transitioning to Personify Health over the course of this year, 2024. Virgin Pulse and HealthComp will transition fully to Personify Health as of 1/1/25. So we're just telling you this so that if you see the Personify Health logo, that you do know that it is part of the Virgin Pulse services. The Virgin Pulse Wellness Incentive Program and online platform are not changing at this time, and we will send out communications to eligible plan members announcing the merger with Personify Health in early December of 2024. Again, Well Baby is our program for creating hopefully healthy moms and healthy babies. Eligibility requirements: you must be a Choices Plan member, and you must enroll during the first trimester of pregnancy in order to get the copay waivers. Your eligibility begins on the date you enroll. It does not go backwards, so you want to enroll as soon as possible to make the most of these benefits. If you enroll during the second or third trimester, you are eligible for all of the benefits except the copay waivers. Again, we don't backdate participant enrollment. So benefits include full benefits for those enrolled in the first trimester include copay waivers for pre and postnatal visits, ultrasounds, routine maternity lab work, and physician delivery charges. These do not apply to the hospital services for delivery. Sometimes there are questions about that, but the hospital charges do not apply. There is a generic prescription prenatal vitamin benefit with $0 copay. You get some choices of pregnancy books or exercise videos. You may enroll in the Take Control Lifestyle Management Program, specifically set up with some specific benefits that are only available to our pregnant moms. And you also get a breast pump you can purchase or rent a standard breast pump up to $300. Enrollment in the Well Baby program, like all of our programs, is confidential and voluntary. Take Control, I already mentioned that they offer some exceptional services for our employees with diabetes or pre-diabetes, with weight management issues, the maternity program, high blood pressure, and high cholesterol. This is a comprehensive confidential education and support program that uses telephonic delivery and allows the participant to engage from anywhere and receive individual attention specific to their needs. This is a one-on-one monthly health coaching telephonic session with licensed diabetes, exercise, and sports science trainers and certified diabetes educators. Again, enrollment is confidential and voluntary. Wonder Health will continue to be offered. This is a metabolic syndrome reversal program. It offers 10 weeks of counseling and personalized skill building, 10 weeks of customized skill reinforcement, and 32 weeks of skill maintenance. This is weekly, self-paced, informative online video sessions. It does include a mobile app, skill enforcement, and habit formation. You have interactions with health coaches and an online community for social support. And this program is available at no cost to MUS medical plan enrollees over the age of 18. I do need to tell you, though, there is a cost to the plan, but not a cost to you. Sometimes people give us feedback that they didn't realize the plan was being billed, and we are billed, but we're doing that so that you have the opportunity to receive these services. We will continue to offer you the opportunity to enroll in Hinge Health for musculoskeletal management. This allows you a 12-week digital program with one-on-one health coaching and personalized exercise therapy. It is delivered remotely using mobile and wearable technology. Again, this is available at no cost to you if you are a medical plan enrollee over the age of 18. Again, the plan does cover the costs of this program on your behalf. And there are a number of musculoskeletal areas that they offer this program for, including the neck and upper back, shoulders, elbows, forearms, wrists and hands, lower back and hips, thighs and knees, shins and calves, ankles and feet. So really it's care for everybody and every body part. Well on target is that Blue Cross Blue Shield of Montana member portal. I would encourage you to go check it out. There are a number of things that you can do. You can set up your own journeys. You can participate in wellness challenges. You can track fitness and nutrition. You can connect your nutrition or your fitness or nutrition device. So a Fitbit, an Apple Watch, those types of things. And you can earn Blue points. and then you can redeem them in their store for apparel, books, electronics, a number of items. And you can utilize this through the Always On mobile app and Well On Target portal. So these do track your fitness activity in real time and give you the opportunity to earn those points and then cash them in for items that you may want. The blue points, once they're redeemed, they may be taxable income by the IRS. If they are, you will receive a 1099 from Blue Cross Blue Shield or the Well On Target, whoever's administering the redemption of those things. So for instance, if you saved up your points for 7 years and went on and got an iPad, you might find yourself receiving a 1099. And we just tell you that so that you're not shocked if that should occur. Blue Cross Blue Shield also offers the Blue 365 member discount program. And this just offers you the opportunity to show that you're a member of Blue Cross Blue Shield of Montana and get some discounts on things like apparel and footwear, hearing and vision services, nutrition, personal care, just a number of things that you could utilize to access some discounts. You can go to blue365details.com/BCBSMT if you're interested in finding out some of those discounts. Delta Dental offers the Amplifon and the QualSight discounts. And we just put in here the opportunity for you to get some savings on LASIK eye surgery or Amplifon hearing aids. And this just indicates what products and services are eligible, what the discounts tend to be. You know, you can visit these websites to find out the providers you can utilize to get these discounts, and then just how to get started. You call either Amplifon or QualSight, and then walk through either the patient advocate service with Amplifon or the care manager with QualSight, and they'll walk you through the process of how to get the confirmation for your discounted pricing and get you set up for your services. Okay, so let's talk annual enrollment and get you out there into the active employee platform to get you enrolled for fiscal year 25. You can go online, you'll utilize the Benefit Solver platform. If you are with Montana State University or the University of Montana, you can go to the buttons on our website that allow you to log in with your NetID login, and you can access the system that way. Community colleges and those of us here at the Commissioner's Office, we have a separate way to log in, but we all end up in the same place with our employee benefits enrollment. So encourage you to get on. I'd encourage you to do it early. We've had people that wait until the very last day and end up having technical issues, whether it's password problem, whatever it might be. I encourage you, get on early. You have 3 weeks to do this, so don't wait until the very last day to get on and complete your enrollment. This is the welcome screen that you'll see. If it's your first time on the Benefit Solver platform, you will need to register and create a password that you'll utilize. For the rest of us who have used the system, we get on and enter our username and password and then log in. And then we come to the member home screen. The home screen will have a pop-up. It will tell you how many days are left in your annual enrollment period. It will remind you that annual enrollment ends on May 15th, and it will tell you just simply click here to start. You will have reminders of where action is required. So it'll start out here in your fiscal year 25 enrollment. So here's the new hire and annual enrollment screen. This is pointing out that if you have a new hire during the annual enrollment period, so we know that right now, those of you listening most likely are not new hires, but you might know people who come on between April 24th and May 15th. There are 2 steps to their process. They first complete their new hire enrollment, which is for the remainder of fiscal year 24. And then they will complete their annual enrollment for fiscal year 25. They need to do the new hire enrollment and then go and do the annual enrollment, because if they don't go do the annual enrollment, then what they enrolled in for the remainder of fiscal year 24 will roll over to fiscal year 25 minus any flexible spending account. This is also true if any of you should have a mid-year change during the annual enrollment period. It does require the mid-year change and then the annual enrollment. I don't know if all of you are aware that Benefit Solver has a My Choice Benefits app. This allows you to have this information at your fingertips on your phone through a mobile app. So the other thing about this is that you don't need to be at your desk on your computer to enroll in benefits. You can do it from your phone. You can do it on the go. So, you know, some people tell us, well, I was traveling all 3 weeks of annual enrollment, so I need to do it a different time. And you actually don't. You can get on this app. I'd encourage you to download it. It gives you the details of your benefits. It allows you to view and change your beneficiaries, and it will allow you to take pictures and upload documents. So for those of you who are adding your children during annual enrollment, you could take a snapshot of your tax document or your birth certificates and upload them, and you have it all taken care of. Just a quick reminder, the dates this year for annual enrollment, April 24th to May 15th. We have closed enrollment for a spouse for medical and dental, but you may add your dependent children up to age 26 for a July 1, 2024 effective date. If you do not submit any changes, you will automatically be re-enrolled in your fiscal year 24 benefit elections, with the exception of your flexible spending accounts. If you want a flexible spending account, you must get on during this time period and enroll, and you must re-enroll in a medical flexible spending account if you want any flexible spending accounts funds to roll over into 2025. Please, 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 I can't stress this enough, because we still run reports and see so many people who do not have beneficiaries listed for your life and accidental death and dismemberment coverages. Please go out and make sure you have beneficiaries and check them to make sure that you do have the beneficiaries listed that you want. We could tell you, my staff and probably your campus HR staffs could tell you all kinds of very unfortunate stories where people did not update beneficiaries, and maybe the beneficiary was an ex-spouse, or the beneficiary had already passed away and there was nobody else listed. So I really encourage you, check these every 6 to 12 months, but at a minimum every year during annual election, and make sure that you have the people that you want to be your beneficiaries listed. You can have more than one primary beneficiary, so if you want multiple people to share it, you can do that. And I also encourage everyone to have contingent beneficiaries. This is important because if you and your beneficiary were to die at the same time, then you would not have a beneficiary for your funds. So have a primary and a contingent. And then one final reminder about beneficiaries: please do not make minor children your beneficiaries unless it is via a trust. A trust for minor children is fine. Those funds can be distributed to the trust. They cannot be sent to minor children. So if you do not want to make things difficult in an already difficult situation for those who are dealing with your passing, do not list your minor children as your beneficiaries. If that is your wish, please set up a trust for minor children. With that, I thank you so much for giving us your time today. I hope this information was beneficial for you and will help you as you and your family members work through the process of making your elections for fiscal year 25. If you have any questions, please feel free to reach out to us at any time. And if you have suggestions or feedback, as we work forward into fiscal year 2026, I encourage you to reach out to me or my staff and just give us your thoughts, ideas, suggestions, because we are already hard at work for what that may look like. Thanks again. I hope that you all have a great day, and thanks for listening.